This video of mine is about hiatal hernia, which occurs when the upper part of your stomach bulges through the large muscle separating your abdomen and chest, that is diaphragm. Your diaphragm has a small opening, that is a hiatus, through which your food tube, that is esophagus, passes before connecting to your stomach. In a hiatal hernia, the stomach pushes up through that opening and into your chest. Earlier, I posted a short video about hiatal hernia on my channel. I hope you have already seen that video, and today I am going to discuss this illness in detail. Well, a small hiatal hernia usually does not cause problems. You may never know you have one unless your doctor discovers it when checking for another condition. But a large hiatal hernia can allow food and acid to back up into your esophagus, leading to heartburn. Self-care measures or medications can usually relieve these symptoms. A very large hiatal hernia might require surgery. Now I'll tell you the symptoms. Most small hiatal hernias cause no signs or symptoms, but larger hiatal hernias can cause heartburn, regurgitation of food or liquids into the mouth, backflow of stomach and acid into the esophagus, that is acid reflux, and difficulties swallowing, chest or abdominal pain, feeling full soon after you eat, shortness of breath, vomiting of blood or passing of black stools, which may indicate gastrointestinal bleeding. You should see your doctor if you have any persistent signs or symptoms that worry you. Well, the symptoms and signs of hiatal hernia are almost the same, like I discussed in my earlier video about gastroesophageal reflux, that is GERD in short form. If you haven't seen that video about GERD, I strongly recommend you should see that video, because that is very informative video about gastroesophageal reflux disease, that is GERD. Okay. Now I will tell you about the causes. A hiatal hernia occurs when weakened muscle tissue allows your stomach to bulge up through your diaphragm. It is not always clear why this happens, but a hiatal hernia might be caused by age-related changes in your diaphragm, injury to the area, for example after trauma or certain types of surgery, being born with an unusually large hiatus, persistent and intense pressure on the surrounding muscles, such as while coughing, vomiting, straining during a bowel movement, exercising or lifting heavy objects. So these were the causes. Now I'll tell you the risk factors. Hiatal hernias are most common in people who are age 50 or over, or those who are obese. Okay. Now I will tell you about the diagnosis of hiatal hernia. Well, a hiatal hernia is often discovered during a test or procedure to determine the cause of heartburn or chest or upper abdominal pain. These tests or procedures include X-rays of your upper digestive system. X-rays are taken after you drink a chalky liquid that coats and fills the inside lining of your digestive tract. The coating allows your doctor to see a silhouette of your esophagus, stomach and upper intestine. Upper endoscopy. Your doctor inserts a thin flexible tube equipped with a light and camera, that is endoscope, down your throat to examine the inside of your esophagus and stomach and check for inflammation. And another test is esophageal manometry. This test measures the rhythmic muscle contractions in your esophagus when you swallow. Esophageal manometry also measures the coordination and force exerted by the muscles of your esophagus. Okay. Now I will tell you the treatment. Most people with the hiatal hernia don't experience any signs or symptoms and won't need any treatment. If you experience signs and symptoms such as recurrent heartburn and acid reflux, you may need medication or surgery. Medication. If you experience heartburn and acid reflux, your doctor may recommend antacids that neutralize stomach acid. Antacids such as Mylanta, Rolaids and Tums may provide quick relief. Overuse of some antacid can cause side effects such as diarrhea or sometimes kidney problems. Medication to reduce acid production. These medications, known as H2 receptor blockers, include cimetidine, that comes with the name of Tagamet, famotidine, that comes with the name of Pepcid, and nizotidine, that comes with the name of Excid. Stronger versions are available by prescription. Medications that block acid production and heal the esophagus. These medications, known as proton pump inhibitors, are stronger acid blockers than H2 receptor blockers and allow time for damaged esophageal tissue to heal. Over-the-counter proton pump inhibitors include lansoprazole and omeprazole. Stronger versions are available in prescription form. While one of my favorite omeprazole is Nexium. That is the generic name of Nexium is omeprazole, and that is also very effective for this treatment for this burning sensation. Other symptoms of hiatal hernia. Okay. Then in some cases we may require surgery. Surgery is usually reserved for people who are not helped by medication to relieve heartburn and acid reflux, or have complications such as severe inflammation or narrowing of the esophagus. Surgery to repair a hiatal hernia may involve pulling your stomach down into your abdomen and making the opening in your diaphragm smaller, or reconstructing an esophageal sphincter. In some cases, hiatal hernia surgery is combined with weight loss surgery such as a sleeve gastrectomy. Surgery may be performed through a single incision in your chest wall, that is thoracotomy, or using a minimally invasive technique called laparoscopy. In laparoscopic surgery, your surgeon inserts a tiny camera and special surgical tools through several small incisions in your abdomen. The operation is then performed while your surgeon views images from inside your body that are displayed on a video monitor. So this was the surgical treatment. Now I will tell you about some lifestyle and home remedies. Okay, making a few lifestyle changes may help control the symptoms and signs caused by hiatal hernia. You can try eat several small meals throughout the day rather than a few large ones. Avoid food that trigger heartburn, such as fatty or fried foods, tomato sauce, alcohol, chocolate, mint, garlic, onion, and caffeine. The thing which I am talking is are triggering foods for these all symptoms. Okay, so you can avoid these foods. Okay, also you should avoid lying down after meal or eating late in the day. Some people are in a habit of sleeping immediately as soon as they take dinner, but it's not generally recommended. Generally, it is recommended that you should have a light exercise such as walk. Okay, or you can just simply keep yourself awake, and it's better to sleep at least 3 hours. 3 hours after meals. Okay. Also, you should maintain a healthy weight. Also, if you are a smoker, you should stop smoking. You can also elevate the head of your bed 6 inches, that is about 15 centimeters, so that your upper body remains in a position so that it does not so that it does not lead to the stomach contents to back up to your esophagus. Okay, because in hiatus hernia and GERD, the most common symptoms are that backing up gastric contents above in the esophagus, and that can also cause sore taste in your mouth also. Okay, so in order to prevent all those things, you can elevate the head of your bed at least 6 inches, that is about 15 centimeters, so that you can avoid these symptoms. Well, this was my video about hiatal hernia. I hope you have liked this video. You will like this video, and if you have any questions about hiatal hernia, you can post your comments in the comment section.